grab your coat and get your hat. Leave your worry on the doorstep. Just direct your feet to the sunny side of the street. Can't you hear a pitter-pat? And that happy tune is your step. Life can be so sweet on the sunny, sunny, sunny side of the street. Hi, I'm your host, Todd Gross. Welcome to another On the Sunny Side of the Street. And our show usually focuses a lot on the side of humanity that you don't hear a lot about, the positive side, people doing things to help other people, people making a difference in people's lives, people overcoming odds. And of course, one of the most important parts of the sunny side of the street is to be able to have your health. And we have people in the world that really work very hard to help promote health in people. And probably most of you are familiar with doctors, of course, and the doctors in your life, but there are many different kinds of ways of practicing medicine. And so today I thought for the audience here in Newton that I would like to focus a little on homeopathy, which is a branch or a way of providing medical services. And we're lucky enough to have with us today Dr. Ted Chapman. Hi, Ted.
Hi.
How are you doing? Thank you for coming.
My pleasure.
And we're going to explore a little bit about how homeopathy works. And I guess as a way of starting, I would ask you a little bit how you got involved in working in this field of homeopathy. And then we'll talk a little bit what it is.
Well, Todd, I grew up in a family surrounded by doctors, and they were mostly research kind of doctors. So
I see.
Basic science. They were curious about life, and they instilled that kind of interest in me. So I was in college, and I spent a year working at a special needs school where the doctor was a homeopath.
Oh, I didn't know that.
Yeah. And the whole environment of this school was and they did many things to help these kids. But I saw the homeopath functioning, and that was inspiring to me in a way that I said, you know, I was interested in medicine, but I never could imagine myself doing conventional medicine for some reason. And when I saw him practice in the holistic way in which he approached the children, I got inspired to study it.
That's interesting.
That was before I went to medical school. So I then decided, well, you know, let me figure out if I can do this, and I went to medical school and
got your MD.
Yeah, got my MD. And curiously, in the first month of my medical school class at George Washington, someone stood up after our anatomy lecture in the back of the room and said, "Is there anybody here interested in alternative medicine?" And this was 1975. 30% of the class walked to the back of the room.
Wow.
And
significant portion.
Well, you know, it's all of us from the boomer generation, you know,
Yes.
who've been through the 60s, who were open to many new ideas.
Yes.
And so we put together a support group, and we actually got funding to do several courses in alternative medicine, one of which was homeopathy. We had acupuncture.
Yes.
And all the mind-body stuff. We had some of the most wonderful speakers, the Bensons, Bernie Siegel, different people who were working in the new emerging field of mind-body medicine. George Washington.
George Washington,
Yep.
Amazing.
So I finished medical school, did my family practice residency, and then did an internship for a year working with a homeopath down in Washington, D.C.
That's how it started.
Yeah.
Very interesting. I didn't know that story.
Yeah.
Maybe for the viewing audience, it would be really good to maybe define a little bit of some of the main principles of what homeopathy really is. Maybe we should talk about that a little bit. We'll have some slides to help us as we go along here.
The word homeopathy, the root is homeo, which means similar. The opposite of this would be allos, which is opposite. In conventional medicine, most of the medicines begin with anti. So we say antibiotics, antipyretics. So their action is to kind of quell or fight the forces that are coming up in the body. So if you have a fever, you get rid of the fever. In homeopathy, we would look at fever as something that the body is doing as part of its protective mechanism. It's the way it's fighting viruses or bacteria.
Mm-hmm.
And we're trying to find a medicine that would support that way that the body's already
Gotcha.
healing. That's what we call the law of similars. Homeopathy means the treatment by similars.
Okay.
So that's the primary principle. The other principle that we're kind of looking at is what we call individualization. So that rather than treating a diagnosis, in conventional medicine, the first art that a doctor learns is to listen to the patient, do the appropriate tests, and then make a diagnosis.
Right.
And that diagnosis then dictates the treatment.
In conventional medicine.
Yes, in
yeah.
conventional medicine. In homeopathy, all of those things are important, but we have to go back to the person, because what's important is the person's experience of that illness. And I think we'll come back to this in many different ways as we talk this morning. The major concept is that we have to find a remedy that is similar to the symptoms that the person is experiencing.
Mm-hmm.
And the way we figure that out is through what we call provings. In homeopathy, and actually in medicine, the first double-blind placebo-controlled trials were homeopathic provings, which is when we give healthy people
Right.
a medicine and we find out what symptoms those people experience when taking that medicine. If you look at the physician's desk reference,
Yes.
which is a big, thick box,
Huge, yes.
you know, we look at what we call the therapeutic indications, and that's a very limited scope. And then there are pages often of side effects.
Yes.
Those side effects are what we call the proving symptoms of a medicine. Okay, so those are all the other symptoms that a person experiences when taking a conventional medicine
Yes.
that are considered untoward and undesirable.
Gotcha.
And we try to avoid them. We try to limit them. In homeopathy, we're looking at not only the totality of the person, we're looking at the totality of the medicine. So we're trying to find a medicine with all those different aspects that every organ system is affected: mind, GI tract, lungs, respiratory tract. All of these different systems are affected by every medicine that we take. And so we're looking at all of those symptoms and trying to find a medicine which, if given to healthy people, produces the same array of symptoms that the person who's walking into our office is experiencing spontaneously.
Mm-hmm. Very.
So that's the law of similars.
Very different. It's a nice,
Yes.
really big contrast between how it's looked at in conventional medicine versus homeopathy.
Right.
Are there some examples in conventional medicine of how homeopathic principles are working?
You know, it's hard to say in conventional medicine. I could give an example of the homeopathic principle that every one of us has experienced.
Yes.
If you cut an onion,
Okay.
a red onion, that's what in homeopathy we refer to that as allium cepa, or the red onion.
Yes.
Okay. You cut the onion and you're chopping it up. You start to notice that your eyes start to run, your nose starts to run.
Right.
You can even get a raw feeling in your throat. The
True.
tears from your eye tend to be kind of irritating.
It's a shame it tastes so good. I wouldn't even do it. Yeah.
Well, but these are not everybody experiences this. Some
Right.
people are more susceptible. Some people, and the susceptibility is a big issue because that indicates that people have a connection to that substance in a
Right.
certain way. So if you walked into my office and said, I'm coming down with a cold and I've got runny eyes and runny nose and it's irritating in a certain
Okay.
way, then the remedy we might give you would be allium cepa. Okay, so that's an example. In conventional medicine, there are examples of medicines that are prescribed using a homeopathic principle, that the law of similars. A very common one is Ritalin.
Yes.
Ritalin is a medicine which, if given to healthy people, produces a kind of hyperactivity.
Right, but for ADD or ADHD.
But then we use it for people who have that same array of symptoms.
Mm-hmm.
And so that's that homeopathic principle.
Gotcha.
Right.
Okay.
There are other medicines like colchicine, which is used for treatment of gout. And,
right, yeah.
And gout is an inflammation of the joint, and it causes red hot sudden inflammation. And if given to healthy people, colchicine produces those same symptoms. And so we use it for treating gout.
Okay, now let me ask you from the point of view of somebody watching this, because it's fascinating what you're saying. So let's say I come into your office and I've got a certain set of symptoms. What kind, give me a little sense what I would experience with a homeopathic physician, what kinds of questions I might be asked, how you might arrive at a judgment of what is called an acute remedy versus a constitutional remedy too, so people could get an understanding of how you think about that, the kind of symptoms people present.
Well, from my perspective as a classical homeopath, I don't really distinguish between acute and chronic remedies, or constitutional. I think most people, there is a remedy that fits them and it would affect them well, benefit them both in chronic and acute conditions.
So it's more individualized, but it's also short and long term.
Right.
Okay.
I mean, that's the idea. So that there's we look at people as a totality. There's a set of symptoms that people present with, and those are evidence of a disturbance in the equilibrium of that system.
Right.
So we're trying to understand how that disturbance is representing itself in every organ system. So the mind symptoms, the general energy, the moods, the appetite, the thirst, the temperature regulation, and as well as the different organ systems, the respiratory, the GI tract, the joints, the skin. All of these organ systems are going to be showing effects in certain ways. And what is referred to as acute remedies is just that it's an acute illness. An acute illness is something that has its own life.
Sure.
You know, an acute illness can come on suddenly and kill you, or it can get better on its own.
Right.
But in homeopathy, we look at the acuteness in terms of the intensity of the way it's presenting itself. And many of the medicines that are sold over the counter, all homeopathic remedies are over the counter medicines, are labeled for acute reasons. So you'll have a headache or allergy or a
yes,
cold
they are.
or
I know
something.
what you mean. Yeah.
And though most of those remedies are what we call combination remedies, and they have a number of remedies in them that are known for their effects, for instance, for a sore throat or for allergy symptoms, and so we're hoping that one of those medicines actually is a specific or is a simillimum. It's similar to the person's symptoms, but it's a kind of guess.
Gotcha.
The
and
way
it's a broad scope because you hope one of them will catch it.
Exactly. So there's 7 or 8 remedies, and hopefully one of them will come close enough to benefit the person. The way I practice, I'm trying to find that one remedy for the person, and that's the individual. That's what professional homeopaths do.
So let's say you find that remedy, and I should say to the audience, he's extremely wonderful at finding those because I know that firsthand from all the people you've helped. How do you make decisions about dosage too? How do you figure? Because I know people are not probably familiar with the different kinds of dosages, but how do you figure that out?
Well, if we look at remedies, they come in usually little granules, which we take on the tongue.
Yes.
And they all look the same, so there's no way you really can tell the difference between one remedy and another based on the appearance. The potency of the remedy can go from what we call a 6 to 1,000 to a 10,000. The common over-the-counter remedies are in the dosage range of 6, 12, 30.
30, yeah.
And they can be a C or an X. The X means diluted 1 to 10. The C means diluted 1 to 100. That's the other principle of homeopathy, is the minimum dose. Okay, so we've got the principle of similars, but then we're trying to find the medicine and you give it in the least amount that you possibly can to get the body to respond and start its own healing process.
Yeah, you can see that on the slide, right, what you were saying.
In a situation where somebody has a tissue kind of disease where it's very slow and whatever, we probably would use a low potency remedy, 12, 6. If somebody has a very acute illness where there's a high fever and and they're very, very disturbed, we might use a higher potency, or if that remedy, if that person's condition is much more on a mental emotional level, then we would use a higher potency remedy.
I see.
But the idea that the most important thing is the similarity, because there are a lot of other kinds of remedies that we call LM potencies, which are given on a daily basis.
Yes.
And all of this is determined by the pace of the person's illness and their own vitality, and it's a complicated decision, the choice of potency.
I want to ask you another question, but make a comment about what you said, because I think one of the things that is helpful about your homeopathic approach too is, as you said earlier, that you take into account the whole person and the individual, and that means emotions as well as physical symptoms, that you're looking at all the systems. And to me, that's very important. What I would like to ask is, for people watching, I can sit here and say from my own personal experience that for my family and myself, remedies have been terrific. Haven't used an antibiotic in 25 years. I'm glad about that. However, the average public doesn't know that there's a lot of evidence that supports homeopathy, scientific evidence. And you mentioned you were raised in a family of scientists. So I know you don't do things unless you feel there's a good scientific basis for them too. So can you give the audience, it may take a little while, but give them a little sense of the grounding of the kinds of evidence that supports homeopathy, so that if they're trying to make a decision, should I go to a homeopath, at least they're aware there's something that they can look at and there is some support.
Right. Well, there are a number of different kinds of evidence. First, what we call epidemiology, which is data that comes from looking at populations. Two is basic science, animal-based studies, or studies in the laboratory.
Right.
And third are clinical studies. Homeopathy, because it's a fairly inexpensive system to practice, hasn't generated the kind of monetary value for companies, so that there hasn't been that much money going into research, unfortunately. There is some really good evidence. First of all, if you look at the world, homeopathy is the second most used system of medicine in the world after conventional medicine.
Yes, that's powerful evidence right there.
In the United States, we think that there's between 7 and 10 million people who've used homeopathy. In places like India, there are 30 homeopathic medical schools, and it's probably the first line of treatment for most people, along with Ayurvedic medicine, which is their conventional medicine. But the European influence brought homeopathy to India, and it took off. South America, Brazil, there's a huge amount of homeopathy practiced. In the United States, it's pretty low key, and there are reasons for that. But homeopathy was here in the early 1800s. The American Institute of Homeopathy was founded in 1844. 2 years before the American Medical Association, which was actually founded in response to the homeopaths organizing.
Is that so? Wow.
And there's been a lot of tension there, but as science has more and more dominated medical practice, and what we call clinical and epidemiological evidence has become less important. One interesting study that was done in, I think, 1999 by Goldstein in the Los Angeles area looked at people who went to see homeopaths. And that was a very interesting study because it showed the kind of characteristics of people that go to see homeopaths. First, most people are fairly well educated. Most were female, but that's true for all doctors.
Yes. We try to avoid it as much as possible.
Men
no matter
avoid.
whether it's homeopathic. I know.
The kinds of the complaints that people went to were chronic complaints. They had them for more than 6 months, and they had seen other doctors, conventional doctors already. So when they saw the homeopaths did a global health assessment and found that most of these people were in good to fair health, so they're not really, really sick people, but the average person like you and I who have complaints and we want relief from them. And then they looked at followed people who went for 4 to 6 months, and 60% of the people showed a significant improvement in their complaints within 6 months. So that's kind of soft data.
Yeah.
There's laboratory data, which I think we can skip in this situation because we don't have time. But in the clinical arena, there are some very, very good studies that include asthma, allergy, high blood pressure, ear infections.
Yes. Yeah.
I mean, one of the most common things that we see are children for ear infections, and conventional doctors. That's also primary care doctors. I mean, the study that we did with the American Institute of Homeopathy looked at the primary care doctor study that's done every 10 years, looking at how many people they say, the characteristics of the people they see, as compared to the physicians who were part of the American Institute of Homeopathy, and we showed a similarity in the top 10 diagnoses, but definitely the AIH physicians were seeing people with more chronic things. So in the condition like ear infection, the regular doctor is seeing the acute ear infection, but after 3 or 4 of those in a year, the parents are saying, something's going on, I need to go a little deeper, and so they come to see a homeopath, and we can help resolve the susceptibility to those ear infections so that kids aren't getting those ear infections.
That's how I found you in the first place with my daughter's ear infection, and they never recurred. So I know that's true firsthand. How do you decide when people come to you, when there's a case where you say, there needs to be Western kind of medicine involved in this case too? Yeah. What kind of considerations?
I don't usually.
How do you do that?
I don't usually see that as a conflict. In fact, we did a study of mild traumatic brain injury that was funded by the National Institutes of Health, and we did it at Spalding Rehab Hospital downtown. And in that study, one of the things we looked at was there a difference between the people who were taking conventional medicines? Most of these people were taking antidepressants or pain medicine or whatever. And those who weren't. And we couldn't find any evidence that there was an interference between taking conventional medicines and homeopathy. And so
it doesn't have to be either or.
So if people are on a medicine for a condition, and it's the kind of condition where we could help, over time people find that they often can get rid of so many medicines that they're taking. So that the side effects that we talked about are reduced. And if somebody walked in my office with chest pain and I thought they were having a heart attack, they'd be in the ambulance to the emergency room right away. We're not going to, there are life-threatening situations, surgical conditions where conventional medicine is appropriate. But most of the things that people have are chronic, insidious complaints which would benefit from homeopathy or nutritional approaches, or a combination of those things.
That's a wonderful way to put it. I'm curious, too, what you would say about what the biggest challenges are as a homeopathic physician, working within this culture, political, economic, clinical. What are the hardest parts, do you think? Because you've been doing this a lot of years. I'd be interested in your insights on that.
Well, the first is a pure disbelief. That
this
any
little bead could make a difference.
That any medicine that where the medicines are so dilute. And you actually have a hard time measuring anything in the medicines, that they could have an effect. Okay. So and as homeopaths, all we can say is, it's true that we don't understand how homeopathic remedies really work. We've been using them for 200 years, and they seem to work. So that there's that kind of evidence to say, okay, let's assume that there's something going on here. And I think that's sort of the state of research in homeopathy. Interestingly, when presented with hard data, for instance, the mild traumatic brain injury study we did,
Yes.
we took a population of people who'd had mild traumatic brain injuries, post-concussion syndrome, and they were symptomatic for at least 6 months after the injury. The average was actually 3 years. People who 3 years after their head injury were still having complaints. These are the kinds of people that we hear about the National Football League and
Yes.
you know,
Oh, sure.
you know,
Yes.
after many concussions. We treated those people, and after 6 months showed significant improvements based on, you know, how measurements like how difficult is it for you to function on a daily basis. 17 different symptoms, conditions that people rated themselves on, showing significant improvements in the treatment group versus a placebo group. It was a
That's an
double-blind
important
placebo.
differentiation you're making there.
Right.
It's because people may say, well, this is just because you expect to get better, and
Right.
there is an expectation effect with any medicine,
Right.
but you're beating that too.
Right. Well, so this was a double-blind placebo-controlled
Yes.
trial.
Okay.
So the standard of gold standard of conventional medicine. That study was published, and it was a pilot study. We had 60 patients.
Yeah.
Okay. And we have tried to get that refunded by the NIH, by the armed forces, who they're saying 30% of the people coming back from Iraq have this
Yes.
condition.
Oh my God, yes,
and,
sadly.
and despite that, we can't get funding.
So there's the politics piece.
It's the belief system. You
The
know,
belief
it's just
system.
there was a wonderful editorial published in Nature, where there was a basic science study done, showing that certain blood cells were affected by dilutions up to minus 120 C, which is like 120
Yeah.
zeros. And the editorial company is, when do you believe the unbelievable? You know, so that's
Yeah, I get you.
So there's and it's completely understandable why
Yes.
that bias exists.
I want to jump in and just ask you, because of the minute left.
Yeah.
What would you say to people about resources that they could look at? Maybe we
Yeah.
could close with that.
Well, if you go online, the best general resource is the National Institute of Homeopathy,
Okay.
which will give you a reference to links to many other sites. Their homeopathic pharmacies, homeopathic educational programs.
I appreciate that.
Yeah.
I want to thank you so
Okay.
much, Ted. That
My
was
pleasure.
absolutely wonderful. And I want to thank the audience for watching. And please tune in again for another On the Sunny Side of the Street. Thanks for watching.
Leave your worry on the doorstep. Just direct your feet to the sunny side of the street. Can't you hear a pitter-pat? And that happy tune is your step. Life can be so sweet on the sunny, sunny, sunny side of the street.